Healthcare Finance and Policy. It is 1 o'clock, but we are going to wait a few minutes just to see if we can get a few more on. So yeah, we'll get started in just a few minutes. Hello, everyone. This is Mahivy with the Division of Healthcare Financing and Policy. Again, we are going to get started in just a few minutes. We are just waiting for a couple more people to get on. Thank you.
What our vision insurance is.
Hello, everyone. This is Nahibi Flores with the Division of Healthcare Finance and Policy. It is 1:05 now, so we are going to go ahead and get started. Chair Swanson, I'll pass it over to you.
Thank you, Nahibi. Welcome, everyone. Good afternoon. On behalf of the Division of Healthcare Financing and Policy, Medicaid Reinvestment Advisory Committee, I would like to call the meeting to order and verify that this meeting is being recorded. Today's meeting agenda for the Medicaid Reinvestment Advisory Committee was posted on June 4th, 2025 on dhcfp.nv.gov and also at notice.nv.gov. And I'll turn it over to you, Daisy, for agenda item 2 to do the roll call.
Thank you. Stacy Weeks, Jamie Sorensen,
Present?
thank you. Fuilalo Riley,
Here.
thank you. Erica Washington, Haley Geralamick, Robert Thompson,
I'm here. I'm having trouble with my mic, but I'm here.
okay, thank you.
And Daisy, does that meet our quorum?
We did not meet quorum.
So not meeting quorum at this time, items can be discussed, but no action or votes will be taken. And should Stacy, Erica, or Haley join us, maybe that will change.
Yes, correct. This is Nahibi for the record with the Division of Healthcare Finance and Policy. Yes, we will not be able to take action, but we can continue on with the rest of the meeting.
All right, thanks.
Yeah.
And then we'll move to agenda item number 3, general public comment. No action may be taken upon a matter raised under the public comment period unless the matter itself has been specifically included on the agenda as an action item. If you would like to provide public comment, please raise your hand or type public comment in the chat and the last 4 digits of your phone number, and then your name will be called on to begin. Please state your first name and last name at the beginning for the recording purposes, and then you will have 3 minutes to speak.
Chair Sorensen, it looks like there are no comments at this moment.
Okay, all right, thank you, Daisy. And then we will look at agenda item number 4, review and approval of the minutes from the previous meeting held on December. I'm assuming that we can take discussion, but we would likely not do a vote on the minutes.
That is correct. Nahibi for
Okay.
the record.
Any discussion or comments on the minutes?
Chair Sorensen, it looks like there are no comments at this moment.
All right, thanks. And then the presentation. So agenda number 5, we're going to have the managed care entities share with us their 2024 reinvestment activities. And it looks like first up is Anthem, and that will be presented by Valerie Levano.
Yes, thank you, Chair.
Thanks, Valerie. Welcome.
Thank you so much. We'll pull up our slides and we'll get started. Wonderful. Well, thank you, everyone. Good afternoon. My name is Valerie Lovano. I'm the Whole Health and Equity Director at Anthem Medicaid. And today I have the privilege of highlighting our 2024 community reinvestments. Next slide. I'll start by discussing how our reinvestment strategy aligns with our whole health approach, which focuses on the integration of physical, mental, and social needs to improve health outcomes and address health disparities. Then I'll discuss our current investment priorities and highlight the successes of some of our funded initiatives. Finally, I'll share a few thoughts on our future investment strategy. Next slide. Anthem has been a proud part of Nevada's healthcare community for over 50 years. Our long-standing commitment provides stability and fosters trust through consistent, reliable, and dedicated support to the community. We care for over 200,000 members, understanding that each person has unique needs and deserves personalized support. And we're committed to health equity, improving the health of Nevadans through our integrated model of care that addresses inequities and promotes resilience. Our dedication to improving health outcomes and addressing health disparities has been recognized through both NCQA Health Equity and Health Equity Accreditation Plus designation. Next slide. At Anthem, we understand that health is more than healthcare. Our person-centered whole health approach addresses physical, social, pharmacy, and behavioral needs to improve health outcomes and advance health equity. We center our approach across 5 domains: maternal-child health, chronic disease management, behavioral health, health-related social needs, and rural health. Although physical aspects of health have traditionally been the focus of healthcare, we know that social factors often play an even more important role in health outcomes. And strengthening communities also has a positive effect on health. Building partnerships and creating connections within communities supports whole health, and our community reinvestment strategy reflects this understanding. We invest in community organizations from a whole health perspective to improve health outcomes. Next slide. Our investments are based upon community need and identified through data. By analyzing demographic, claims, health information exchange, as well as community social data, we're able to identify health-related social needs at the individual, family, community, and even state and county levels. Conversations with members, providers, community-based organizations, and other entities are also an important part of understanding which social factors are most pressing for our members and community. We use what we learn from this data to design internal interventions and to identify external partnerships to address those needs. And many of these external partnerships are supported through community reinvestment funding. Next slide. In 2024, Anthem invested over $8.5 million in 125 local community organizations. Our investment efforts align with Anthem Whole Health goals, as well as with Reinvestment Advisory Committee funding recommendations. We're really proud to partner with organizations like Baby's Bounty, Communities in Schools, Community Chest, and the Center to improve health outcomes for our members and communities. Over the next few slides, I'll highlight some of our key 2024 investments that address housing instability, food insecurity, workforce development, and community wellness. Next slide. Housing is a top priority for Anthem. We understand that unhoused members can't focus on their healthcare needs. We believe strongly that housing is healthcare, and we partner with numerous community organizations to address housing instability. In collaboration with trusted community partners, Anthem offers a robust array of housing services for members at risk of homelessness and for those exiting institutions, including prevention and diversion services, as well as emergency and supportive housing programs. We invest in eviction prevention, rental assistance, landlord-tenant mediation, and a variety of other tenancy supports. In addition, we provide behavioral health urgent stabilization housing, emergency shelter, and recovery home housing options. Our supportive housing programs include shared housing for high utilizers of medical care, as well as permanent supportive housing. We also ensure connection to affordable housing options and access to coordinated entry for other housing resources. Next slide. In 2024, we received and reviewed 966 housing referrals. 102 households were prevented from homelessness. 23 families with children were provided emergency shelter. 859 members were assisted with urgent stabilization housing, and 764 permanent housing placements were made. In total, 1,342 households received Anthem housing services in 2024. While these numbers show just how many lives our housing programs touch, our members tell the real story of how Anthem's investment in housing changes lives. Through our partnership with Nevada Legal Services, our member Julie was able to avoid eviction and homelessness. She originally contacted Nevada Legal Services for assistance with a 5-day notice of unlawful detainer. After reviewing the case, the attorney determined that the eviction notice wasn't legal, but that Julie wouldn't be able to stay in her current living situation much longer regardless. So the attorney not only filed a response on Julie's behalf to dispute the improper notice, she also simultaneously applied for Anthem housing assistance to cover the security deposit for Julie to move to a new home. The attorney then represented Julie at the eviction hearing, and the court ultimately denied the landlord's summary eviction. As a result, Julie was able to avoid eviction and sign a new lease for a home where she can remain for the foreseeable future. Next slide. At Anthem, we understand that access to food is just as important as access to safe and stable housing for improving health outcomes. So in 2024, we invested significantly in programs addressing food insecurity. We supported food banks in both Washoe and Clark counties, as well as funded several food pantries and food distribution efforts, including those run by Community Health Alliance, Healthy Communities Coalition, and Catholic Charities. And we were pleased to invest in Baby's Bounty, which provides baby supplies, including infant formula to families in need. Lastly, we were very proud to invest in a fully accessible community garden at Notable Music Therapy Services, which will offer fresh produce this summer to folks in need in a food desert in northern Nevada. Next slide. We also believe in doing our part to address Nevada's provider shortages. As a result, we invested in numerous workforce development initiatives to train and retain Nevada medical professionals. We continue to support Project ECHO programs to improve provider capacity to address their community's most pressing medical concerns. We also provided support to increase the number of certified doulas and community health workers in Nevada, with an emphasis on the recruitment and training of providers in rural parts of the state. We continue to invest in graduate program scholarships for new emerging public health professionals, as well as continuing education for existing healthcare providers. And we were proud to fund the Nevada Physician Wellness Coalition's efforts to enhance physician retention through behavioral healthcare support. Next slide. Anthem believes wellness and prevention are key to improving health outcomes long term. We invest substantial time and resources into efforts to keep people healthy. Some of the prevention and wellness initiatives we supported in 2024 include expansion of Project Maryland services to ensure no-cost feminine hygiene products are available to those who need them most. Indigenous youth wellness activities using traditional ceremony and healing practices. Anything but the gym health coaching to assist with the transition from a sedentary to active lifestyle. Expansion efforts at 2 federally qualified health centers, and support for Washoe County's Behavioral Health Crisis Response Program. Next slide. In 2025, we'll continue to align our investment strategy with community need, state priorities, and Reinvestment Advisory Committee recommendations. Given Nevada's housing landscape, housing services and supports will remain our top focus. We'll also continue to invest in community organizations that address social need and promote health and wellness. Additionally, we'll look to extend the reach of our investment efforts, focusing even more on school-based services, behavioral health interventions, and workforce development initiatives. Next slide. In closing, Anthem proudly partners to advance health equity. We take a holistic view of health, putting people at the center of everything we do, and building partnerships to strengthen communities. We closely align our reinvestment strategy with these efforts, and we're excited to continue serving our members and Nevadans equitably and respectfully, and to provide the highest quality programs in 2025 and beyond. Next slide. And I think that's it. Thank you for your time. I'm happy to answer any questions you may have.
Thanks so much, Valerie. Thanks for sharing your slide deck and the presentation. This is great information. For our committee members, do you have any questions or comments for Valerie?
Hi, it's Gulala. None here. Thank you so much for the presentation.
You're welcome.
All right. Thanks, Valerie. Appreciate it. And then
Uh-oh, Chair Sorensen, I think you are muted.
okay. We're going to move on next to a presentation from United Healthcare Health Plan of Nevada, and Rachel Rosensteel and Anjali Hale are going to present.
All right, thank you so much. My name is Rachel Rosensteel, and I'm joined today by my colleague Anjali Hale. We had the pleasure of starting our journeys with United Healthcare together nearly a decade ago as community health workers. Since then, we both have served in a variety of roles, from working out in the community directly with our members to working in health plan operations behind the scenes. Our time spent engaging with individuals, families, and communities across Nevada has given us a deep understanding and appreciation for the unique needs of our fellow Nevadans.
Thank you, Rachel, for that wonderful introduction. To share a little bit more about us, we are both proud Nevadans, born and raised here, and now raising our families in this community. So our roots run deep, and our commitment to this state is personal. We are passionate about supporting the communities that will shape our children's future. These community reinvestments aren't just important, but they're essential to building strong, inclusive environments where people from all walks of life can thrive. So thank you so much for having us here today, and I will hand this back over to Rachel to get us started.
Thank you, Anjali. Next slide, please. HPN has proudly served Medicaid recipients throughout Southern and Northern Nevada for 28 years. We are deeply committed to collaborating with both large and small community organizations to enhance health outcomes and promote health equity. We recognize the vital role that our partners play in shaping the health and well-being of Nevadans. Our efforts are centered on supporting underserved populations and building healthier communities. Guided by state priorities, community needs, and population health strategies, our investment approach is both strategic and impactful. In 2024 alone, we partnered with over 100 local organizations and we reinvested $3.4 million back into Nevada communities. Next slide. Our approach centers around Nevada's families and individuals of all ages throughout all stages of life. In 2024, HPN continued our commitment to advancing health equity and supporting underserved communities through strategic investments across several critical areas. We bolstered the housing continuum of care by partnering with local organizations to address housing instability. In maternal and infant health, we focused on eliminating disparities and improving outcomes for women and infants. To expand access to care, we invested in programs that brought much needed specialty providers to high need areas. Behavioral health remained a priority with enhanced support services and the development of youth-focused mental health programs for our communities. We also addressed a broad range of social drivers of health, which included food insecurity, digital access, period poverty, workforce development, health and financial literacy, and life skills for families and individuals. Our workforce development efforts aim to strengthen Nevada's healthcare infrastructure by supporting training and capacity building initiatives. Through trusted partnerships, we empowered community-based organizations to continue delivering essential services, ensuring that all Nevadans, regardless of their background, have the opportunity to live healthier, more stable lives. Next slide. Listed on this slide are some of the organizations that we partnered with in 2024. While we don't have time to go through each of these today, we will highlight a few examples. For behavioral health, we supported UNR's School of Medicine, Department of Psychiatry and Behavioral Sciences to bolster the behavioral health workforce. This funding was used to start an addiction medicine fellowship program and expand existing programs. Residents in the program will have a hands-on experience to help improve healthcare access for underserved populations. This program will lead to innovative solutions and best practices that can be implemented statewide. For maternal health, we supported Babies Bounty's Center for Families. This center is assisting in the expansion of Babies Bounty current programs and has resulted in additional space to host in-person community resource fairs, baby showers, and informational events. It also includes a classroom specifically focused on maternal health and wellness, where participants are receiving in-person educational and instructional courses regarding prenatal and postnatal care, along with maternal physical and mental health. For access to care, we supported the Nevada Physician Wellness Coalition in enhancing their current programs and services, promoting provider engagement, and building community connections to address and reduce physician burnout. This partnership will help to increase access to care by improving the overall well-being of physicians in the workforce. Next slide. To address food insecurity in Nevada, we partnered with the Just One Project, which supported 3 no-cost markets at Clark County School District sites. The markets feature fresh groceries, produce, recipes, nutritional advice, and household items. Individuals visiting these markets can also access the organization's Community Connect wraparound services, which includes homeless prevention services. This funding also supported the creation of the Groceries on the Go mobile food pantry, which brings fresh groceries to food deserts throughout Southern Nevada. I will now hand it back over to Anjali to talk about some of our outcomes.
Thank you, Rachel. Next slide, please. Our continued efforts to support families and individuals across Nevada have yielded significant results. Through strategic partnerships and dedicated programs, we've expanded our reach and deepened our impact in addressing the needs of Nevadans. We supported Communities in Schools Integrated Student Support Program, which successfully raised graduation rates and prepared students for college and careers. 916 students were served in the program, and 100% of those students were promoted to the next grade level, while 93% of them graduated. This program plays a critical role in ensuring students stay on track academically and socially, preparing them for long-term success. Our investment in Olive Crest reached 891 Nevadan families in the Early Intervention Pathway Program, which serves vulnerable children and families in crisis. 99% of these families in crisis remained together while they stabilized, avoiding both the child welfare system and voluntary hosting. 99% of children from these families did not enter the child welfare system. Next slide. As previously mentioned, to reduce food insecurity in Nevada, we partnered with the Just One Project through accessible food distribution programs. These programs serve nearly 7,000 individuals and families, providing over 74,000 pounds of food. These programs ensure that nutritious food reaches underserved neighborhoods, helping to alleviate hunger and promote health. To increase resources for low-income families with infants and young children, we provided funding to Baby's Bounty Center for Families, supplying baby bundles, portable cribs, car seats, and safe sleep and baby basics classes to over 36,000 families in Nevada. Baby's Bounty continues to be a vital resource for the community. Next slide, please. To address health-related social needs for families in underserved areas, we funded a family health festival that served 803 individuals and families. To provide access to healthcare services and essential support, we funded Almon, which served over 300 individuals. And to improve childhood education and literacy in under-resourced communities, we partnered with Spread the Word Nevada to serve nearly 42,000 children, distributing over 400,000 books. These efforts reflect our ongoing commitment to health, education, and community well-being. We are very proud of the progress we've made and remain dedicated to expanding our reach and deepening our impact. Next slide, please. Here we would like to share with you a member story that highlights how impactful the community reinvestments are to Nevadans. One story is of Kyle, a devoted father who faced unimaginable challenges, but found strength and support through Olive Crest's early intervention program. The early intervention team was able to connect him and his family with stable housing, which resulted in his family being able to stay together. His story is a powerful reminder of the impact that compassion and community can have on a family in crisis. Next slide, please. We are also proud to share heartfelt testimonials from our amazing community partners, because none of this work would be possible without their collaboration and support. Our partners shared the impact our community reinvestment program has had on their organizations. According to our partners, this funding helped Nevadans develop new skills and grow in a positive and stimulating environment. Our commitment to addressing food insecurity has helped break down barriers and create access to nutritious food while helping manage chronic health issues. Our focus on housing needs in Nevada has created more housing opportunities while building a stronger, more connected community. We've continued to demonstrate our commitment to Nevada's health systems by building strategic relationships and supporting physicians. Next slide, please. For 2025, we aim to expand our focus on improving healthcare access and quality as Nevada continues to face challenges in ensuring adequate healthcare access for low-income individuals. HPN is dedicated to improving access to care in Nevada by continuing to reinvest funds into workforce development programs, accredited higher education institutes, local organizations, and Project ECHO. HPN understands the vital need to eliminate disparities around hunger, remove barriers, and increase access to social supports. We will continue to support programs and investments that address social drivers of health for Nevadans. Our goal is to create equal opportunities for marginalized communities by investing in programs that support the basic needs such as food, health literacy, workforce development, and life and family skills. And lastly, we will continue to focus on improving outcomes for maternal and infant health in Nevada. In 2025, HPN will provide reinvestment support to local organizations to promote opportunities and improve outcomes for women, infants, and toddlers. Throughout the year, we will continue to identify reinvestment opportunities within these areas of focus to best serve community needs. Next slide. Okay, this concludes our 2024 Community Reinvestment presentation. Thank you all so much for your time and the opportunity to serve Nevada.
Thanks so much, Rachel and Anjali, for all of your great work. These are all such essential programs for communities throughout the state. So thanks for your presentation. For committee members, any questions for Rachel and Anjali?
None here. Thank you.
Thanks, everyone.
Thanks so much. And then we will move on next for a presentation from Molina Healthcare, and Kim Gahagan is presenting, I believe. Kim,
Oh,
are you?
I hate to disappoint, but unfortunately, with the date change, Kim was scheduled well-deserved PTO. So this is Rob
Okay.
Hoffman, plan president from Molina Healthcare Nevada, stepping in for Kim. So hopefully,
Great.
I can live
Thanks so
up
much
to
for
the same
joining us.
standards that she would do justice for today. So look, let's go ahead and flip forward to slide 3, Philip, if we could. Great. So first off, I just want to call out, we utilize the report the MRAC put out in terms of the priorities. And so you see down at the bottom of the page here how we've really focused in, and aligned with those priorities in terms of where we directed our dollars. You'll see there on the page our total amount that we granted for the 2024 calendar year, the $702,000. Now, I do want to just call out that does not include in lieu of services or said otherwise like housing for our members. This is all money that was spent for the community benefit as required. So just want to make sure it's clear on where these grants were going out to. Philip, if we want to go to the next slide. One of the key pillars, and will continue to be a key pillar as we look towards the future, as well as access to care. Obviously, I think everyone's well aware of the challenges the state faces with, I think, every single county within a healthcare shortage area. Our priority here is to make sure that we enable not only our members, but other members, the community in general, to have access to care in these services. You see on the right-hand side there a number of groups that we did make contributions to in order to benefit that both in Clark and Washoe counties. Phil, if you want to switch to the next slide. Another key area of focus and an area where I know, specifically related to the DOJ settlement, we have challenge in the state around behavioral health and access along those lines. And so you can see some of the organizations that we partnered with: NAMI of Northern Nevada, Community Health Services, Thrive Wellness, Community Health Services, and Bristlecone Recovery Center, making contributions to those organizations to not only support the care that they currently give, but to also expand and provide additional services in our communities. And then, Philip, you want to go to the next slide? Another key area, particularly in our space, is maternal health. So you've got 3 organizations there on the right-hand side that we contributed to there, really making sure that we're helping drive quality care outcomes for the population in general. And Philip, next slide. You notice I'm going very quickly for you all. The next 2 areas, they're sharing a slide only because we didn't need as much real estate for the overview description, not because they're any less important. Workforce development, which leans into that access to care element, but really focusing on recruiting it and retaining, right? Because it's one thing to recruit them. How do we make sure they stay in the state? Nevada Physicians Wellness Coalition, a key contributor to that. Additionally, Project Echo with the University of Reno, making sure that those resources are out there available to support our physician community. Last on this slide, health-related social needs. A couple key groups that are helping on that front. Share Village and Skiing is Believing. And Philip, next slide. So really just want to hit on for folks in the audience just what our process is. How do we make a decision on where we're making grants? We do not run a formal process where folks apply for money. If Kim were on the phone, she'd say, yeah, Rob has informed me that we are not a bank, and we don't desire to just be a giver of funds. Our approach is really one of partnership. So we're really taking the framework of where are the key priority areas. We have internal conversations. We have conversations with stakeholders in the community to identify, are there groups that would benefit and could help further what they're already doing to be able to make a continued impact in our communities. So we have that as an internal conversation that's constantly going on throughout the course of the year. We identify these groups, and then we really work to partner with these groups. The last thing I want to do is just come in, give them a big check, and walk out the door. We want to be there, help support them, help them work through any challenges that they may have, help connect them with the right groups and individuals in the state. Really look at our role as a convener and making sure that the right parties get to the table to help support them on a go-forward basis. And then Philip, the next slide. And then really here, just looking forward, our key focus is making sure that we're hitting on the priorities identified, but making the biggest impact in our community. So really finding groups that are going to go out there and have an impact and make sure that we're getting that detail back through our collaboration with them. Hey, are we doing the right things? If groups aren't making headway like they promised, we evaluate that and we make a potentially a different determination for the next year. All in all, I think we're really proud of the work that we've done in the community to date, and look forward to continued involvement and contributions to help drive improved outcomes in the state. The next, Philip, I think that's it. So overall, thank you. We appreciate the time today and your continued guidance and recommendations on where we can have the biggest impact. So with that, any questions?
Great, Rob, thanks so much. We appreciate you joining us this afternoon and covering this material with us. So thank you. And for committee members, any questions for Rob? No, looks like no questions. All right. Thank you, Rob. Appreciate it.
Thanks, everyone.
And the next presentation is Silver Summit Health Plan. And Nicole King, it looks like you're all teed up to present. So thank you. Welcome.
Thank you. I can't see this. Are they being displayed yet?
Hi, Nicole. This is Mahivy for the
Hi.
record. I can share the slides if you'd
Okay.
like.
Thank you. I'd love that. Thank you very much.
Can you see them?
Yes, thanks. Okay, next slide. So a little bit about me. My name is Nicole King. I oversee our community investment process at Silver Summit, among various other duties. But I am a native Nevadan, been here 4 generations. But I bring a unique perspective to this space because I started my career in the nonprofit space, working for and then ultimately operating a nonprofit up here in Reno. So I really get the community network space. In fact, I feel way more comfortable in that space than I do in managed care. We designed our community investment program based on the way that nonprofits operate and how they are used to receiving funding. I just wanted to give a little bit of background on that. So our approach, it's transparent, first of all, it's data-driven, and it aligns with this committee's recommendations as well as Nevada Medicaid priorities, but most importantly, our members' needs. Also, we believe that at Silver Summit, it's not just about how much we give, but how we give. So we do have a competitive open application process. Last year, we received 78 applications, and we have a review committee that consists of committee members. So we identify people from the community who are familiar with a grant giving process. They sit on the review committee, also staff members, but most importantly, we have Silver Summit members who are on the review committee making the decisions about where the funding goes. And then after the committee determines the organizations that will be funded, I review that, and Eric, our CEO, and Andre, our CFO, we all review it together, and then we have the final sign off on who is awarded funding. And then our team of community health workers, each organization that is awarded dollars gets assigned a point of contact staff person from Silver Summit. And then we stick with them throughout the entire year, checking in all the time about how the investment is going. Do they need anything from us to make sure that they're successful? And the reason why we do that is because our process and selection review committee rubric is so heavily focused on outcomes. So we want to make sure that we are constantly driving toward outcomes, since the dollars are so precious and often feel, inadequate. We never have enough money. So next slide. Next slide, please. So these are the organizations that we funded in 2024. And you can see our priorities here are very similar to my colleagues in the other health plans and absolutely align with this committee's priorities, our members' needs, and Nevada Medicaid's priorities. I'm not going to go through the whole list here, but this is who we gave to. Now, just to be clear, this is just in Clark County. At the end of this presentation in the appendix, we have the list of all of the organizations statewide that received funding from us with a brief description of who they are and what they intend to do with the money. Next slide, please. Next slide. Thanks. So I wanted to touch on briefly, this is a partnership that we funded with our parent corporation, Centene. This is going to happen in Clark County. This is a 10 to 15 year housing development. So it's not just one unit, it's an entire community that we contributed to. At the completion of the project, there will be affordable housing units that Nevada Medicaid members will be able to afford. So there will be units in this development that are below the 30% AMI, which was really important to us because, of course, That is our population, but it's a mixed income development. So that was the other reason why we wanted to participate in this project. So I'll be talking about this for many years to come, as it is a multi-year project. Next slide. So as I said, we are heavily invested in outcomes because we need to make sure that the dollars are working. And you can see here that when we invest in partners like those presented, our members' health does improve. We all know that when we focus on those social determinants of health, ultimately it improves their overall health outcomes. So if we look at Salvation Army, I love this. Of all the members that we served, that they served, like they did it, 76% obtained employment. And this is for some of our members who were chronically homeless. They took over their rental payments, and also at the same time, we're tracking to make sure that they're receiving the medical care that they need. Help of Southern Nevada, 85% of those that were served received employment training programs. And then they also are getting the care that they need. So we really do look to partner with entities like these because they serve both needs, both the social determinants of health and the medical needs at the same time. Next slide, please. For our justice-involved reentry services, Freedom House continues to be one of our key partners because of their continued success with their outcomes, in that 89% did have a reduction in recidivism with the justice system. Next slide, please. Increasing access to healthcare is a major priority of Silver Summit's. We invest heavily with Cure for the Kids because of the huge need within the pediatric subspecialty cares throughout Nevada. So they were successful in recruiting the pediatric hematologist and oncologist. And also we funded Nevada Primary Care Association for them to expand, help train up and expand the mobile unit program throughout the FQHCs. Next slide, please. Workforce development for our members is another huge priority for us. So NAMI, we provided them funding to increase the number of peer support specialists that they trained and that are now working out in the community. And then the Salvation Army, they have their incredible vocational program that we also funded for our members, because, you know, if we're going to support so heavily housing services, we also have to support the workforce development as well. Next slide, please. Youth recreation and prevention of at-risk behaviors. The Boys and Girls Club runs a workforce development program for teens. It's really impressive, the outcomes that they get. So 46 of those kiddos got part-time jobs after completing this program. Next slide, please. So just, again, our members, I think we all really do appreciate the opportunity to be given the opportunity to give money, because our members, they really do get impacted by these dollars, and so do the partner organizations. It's incredibly meaningful that we are able to do this. So I just wanted to show a few personal testimonies from both a partner and a member. And next slide. So as I said, we have all of the investments that we've done. In 2025, we've really focused heavily on increasing access to care, provider workforce development, career development for our members, and also, of course, housing support for our members. But also, we're investing heavily in capacity building for the housing support providers to prepare them for the new benefit, that in lieu of service housing support benefit that we're all of our managed care organizations are getting ready to implement very soon. Maternal child health is a huge priority, And we've invested heavily this year in that. And then also children's behavioral health. We've invested heavily in that as well. And that's all I have to say for today. That's our presentation. Does anyone have any questions?
Thanks so much, Nicole. Appreciate the information very much. Yeah, for committee members, any questions for Nicole?
Hi, Nikki. It's Kulala. Thanks. No questions, though.
Hi.
Great. Thanks, Nicole. Really appreciate it. And in these presentations, you know, I think we heard some themes around how the communities are being impacted and touched, and areas of food and housing, equitable access to care, behavioral health, maternal and infant health, justice involved, community reentry, workforce development, school student support. So initiatives and areas of focus that are meaningful and have a really big impact on communities, individuals, families throughout the state of Nevada. So thank you. Our next agenda item, item number 6. It looks like this is an opportunity for committee members and discussion, a report or some maybe brainstorming about local government initiatives to address homelessness, housing, and social determinants of health at next meeting. So as we think about lifting up areas for focus for the next cycle, maybe what are some things that rise to the top? And I can maybe just kick it off with a few comments if that's okay. I really appreciate and think that our communities are increasingly going to need some of those hard, tangible supports and resources like food, transportation. I also think that housing is just very critical, and I would like our systems to move upstream toward early intervention and prevention of evictions. I see that the governor did sign AB 475 today, which allocates $15 million in eviction diversion to Nevada. And so I think that's just really important, but I think we need more. I also think we need more focus on workforce development, because people need to be able to sustain in this economy. I think the school and student support areas are really critical. And then something that we haven't really heard much about or talked much about is for people experiencing homelessness, people who are elderly, disabled, people who are lower income, services and resources for heat mitigation and response. Over 500 people died last summer season from heat, and it's just a very serious issue. And it's an expensive issue for emergency rooms and providers. So more initiatives, more heat, more resources targeted toward heat mitigation and response. So with that, I'll invite other committee members to offer comments and ideas as well.
Hey, Jamie, it's Fulala. Ditto to everything that you said. Obviously, we are seeing an uptick in individuals coming into our offices needing more prevention, and even like the problem-solving flexible dollars that could really help them like avoid spiraling deeper into the homeless services systems. As we all know, it's much cheaper to keep them in housing. Something that we're concerned about is the weatherization programming that we have that deals with elderly that are in their homes but need the interventions of, you know, like the replacement or repair of their HVAC units. if those homes become uninhabitable for those senior citizens, they wouldn't be able to afford the rental in this market. So right now, nothing has happened. Money is still flowing for weatherization, but there are a number of senior citizens that aren't quite hitting the 150% of the poverty level that's required to receive some of that funding. So flexible funding, maybe to include 200% of the poverty level, would be super helpful, but we are seeing a little bit of an uptick with those senior citizens, and I would hate for them to enter into the homeless services area because they couldn't keep up the repair and the HVAC systems in their homes, or maybe there's there's work that needs to be done with the water heater exploding, that sort of thing. So along with everything that you said, I would just like to maybe throw a little bit of a highlight onto those senior citizens that are housed, but very low income.
Thank you, Falala. Any additional comments from committee members? And Daisy, I'm just wondering if perhaps Stacy, Erica, or Haley have joined the meeting.
No, they
No.
have not.
Okay. All right, we'll move on to agenda item number 7, just to announce that the next meeting is scheduled for November 13th, 2025. And then we'll move on to agenda item 8, which offers an opportunity again for public comment. If you'd like to provide public comment, please raise your hand or type public comment in the chat, and the last 4 digits of your phone number and or your name will be called on to begin. So when you're providing public comment, please state your first and last name at the beginning for recording purposes, and you will have 3 minutes to speak. So we will open it up for public comment at this time.
Chair Sorensen, there are no comments at this time.
All right. Thanks so much, everyone, for joining the meeting this afternoon. To the presenters, we really appreciate the slide decks you prepared for us, the work that you've done in communities throughout the state, and taking the time to share the information with us this afternoon. We appreciate you, so thank you very much. And with that, I hope everybody has a great rest of the day and weekend ahead, and we will adjourn the meeting at 2:03 p.m. Pacific time. Thanks, everyone.
Thank you, everyone.
Now, Ivy, do you have a second to stay on?
Yes.
So